when Fab asked, like, what do people not know about, like, COVID and things like that, like, it really is a long list. But walked out of a code, we have 3 staff members. So we're doing chest compressions for a half hour before anyone shows up. And I had a patient yell at me because I didn't get their Jell-O when I got out of there. That's the real life of it. That's how it went.
What do you think? Does it like, I want to
it's
kill
hard.
you?
You have to, like, refresh, you know? Like, you're sweating bullets, maybe crying, and you're like, okay, here we go. Like, it's game time again.
What does this mean, winning this award?
Well, like you said, like, it's not just us. It's like, you know, it's everybody. It really is, like, our whole team. You know, like, I wouldn't be the nurse that I am without all the people that I've worked with and that have taught me so many things. So, like, I feel like I'm just a representation of, like, you know, my whole team behind me. So, and then everyone along the way, I guess.
And you're so young, and this is
I know. That's what everyone says. I had a patient ask me last night, and he's like, so are you, like, learning? Are you, like, you know, learning here? And I'm like, no, I'm a nurse. He's like, you're like a real nurse here? I'm like, I'm a real nurse. I'm charge nurse tonight. Yeah. I promise I'm
So
real.
I can really make you hurt.
Yeah.
If I want to, right?
Yeah, it's like, don't play with me.
You know, school is close enough for you that you remember all the things that they taught you in school. Yeah. What didn't they teach you that you learned on the job?
Well, I mean, nobody knew COVID was around the corner. You know what I mean? That was a whole new thing. I remember, like, going onto the COVID unit, and we're kind of like, we didn't, you know, it was like we were all kind of learning from each other. And to be honest, like, the travelers, the people that saw it in the big cities first, like, they brought a ton of knowledge. But there was a lot of things, like, you just didn't know to expect. You know, we touched on, like, death and dying, or, you know, talking to families, things like that. But until you're really in the situation, like, it's not the same. It's not real. So, you know.
When, you know, we've heard from many people that having a good support system is really important in this kind of career.
Yeah.
What has that been like for you, and have you had that support system?
Oh, yeah, of course. So, like, I have, like, my mom, my dad, you know, they don't necessarily know a ton about healthcare. That's not the profession they went into. And my mom's really squeamish, so talking about, like, work things with her, you know, there's, like, a fine line. But having people that, like, kind of understand what you do or have worked it themselves. So, like, Amy Becker, that's out there, she's kind of a big deal at Mercy, but that's my mother-in-law. So, you know, I'm able to, like, tell her stories and, you know, ask for advice, things like that.
Is it hard for normal, average people just to understand, like, you know, what this is all about?
Normal people, well, like, we're not normal.
You're superheroes.
Well, thank you. I think that there's things that people don't think about, but I don't know. I mean, everyone's been touched by, like, illness or touched by, like, everyone knows somebody that's been in the hospital. So, like, it's not a foreign concept. I just think there's certain things that people just don't necessarily think about, like, but, like, it's not really our job to be like, oh, it's this hard, or we work this hard. People don't know that nurses work hard. It's not, you know, it's not a foreign subject, but.
What advice would you give those students that you were?
Well, I always tell people, like, my biggest regret in nursing school is I didn't get in at, like, you know, more like entry level, like a CNA. You know, I think people think, like, you know, it's not glamorous work, you know, but I think, like, just getting your foot in the door and seeing from the beginning, and you gain a lot of respect for, you know, what everyone else does there. I don't know, I guess believe your professors when they say things like, oh, trust me, like, it's going to be this way or something. They know what they're talking about, so don't brush them off, because, like, things will be hard, but. And then just make sure you've got a support system. Find people that you're able to talk to. Maybe not your mom if she's squeamish, but find someone that, you know, you can vent to or tell stories to, or, you know.
When you see other ones that were recipients today, 40 years, 41
I
years.
know, that's crazy.
What does that make you think, you know?
There's been times, I think every nurse, like, especially bedside nurses, think, like, okay, I gotta get away from bedside. You know, it can be a little bit backbreaking, but I've, like, looked around at different places, but I can't leave bedside. I like spending that time with patients. Like, I like, you know, we always see, like, new things, and sometimes we see patients come back in, which isn't really, like, a good thing, but, like, just seeing, like, how they've grown or how things have changed, hearing about their lives, like, I like bedside nursing. I don't think I'm leaving.
Are you a good patient?
No.
No.
No. They talk about Dr. Google, so, like, if you learn all this information from the internet, well, think about what 4 years of school does and experience bedside, you know, like, you always think the worst. Like, I remember going through nursing school, and every subject, so whether we're on, like, neuro or cardiac or something, like, oh, I think I have that. It's like, I think that's me.
I feel something here.
Yeah, right? It's the same as Dr. Google, so I'd be willing to bet most of us nurses don't make very good patients.
Do you second guess the nurse that's dealing with you? You should be asking this, or you should be doing that.
And not necessarily. Well, thankfully, I haven't had to be in like an acute hospital setting before, but sometimes like at the doctor's office or something, like there was a time they didn't take my vitals and I'm like, my blood pressure, like, what are you doing? But no, I mean, I trust that everyone's got, they know their unit, they know what they're looking for, they know, so.
Now, when you look at this award, what will you think?
Well, mine is from a time during COVID, so it's kind of like, it's a good reminder, I guess. Like it felt like a time that seemed like there was no reward. We weren't seeing like a good outcome. Like we were, like not seeing an end to what was going on. So it's kind of, as much as we don't want to remember COVID, it's kind of like a good way to look back on it. So
a good way to remember a bad time.
Yeah.
Great. Thank you.
Thank you.